Welcome to this next session for this afternoon here at CONVERGE. The session is Connecting the Dots, addressing the social determinants of optimal aging and disrupting disparities to democratize optimal aging. My name is John Street, and I am the operations manager of Resonate Recordings. Resonate is a podcast and media production company here in Louisville that has the privilege of working with about 400 podcasters internationally. We have the privilege of working with some respected brands like the Associated Press, Citibank, UBS, EA Sports, as well as a number of collegiate institutions such as Notre Dame, Stanford, and Cornell. And as David mentioned earlier, we also have the privilege to partner with David and his team for their new podcast for HEN called Healthconomy, which is a podcast that digs into the healthcare developments that are happening right here in Louisville. So just briefly before I introduce the panelists, the goal and the mission of Resonate Recordings is to create an easier way to podcast and to enable organizations, institutions, and individuals to be able to focus on creating content and getting their message out for other people to hear, while they bring our team in to help them navigate issues with recording and distributing and marketing their podcast. And so from our experience, we know that many people understand the value of podcasting to get your message out, to get it in front of other people, for them to hear and understand. But many people are looking to have independence and control in the things that they are best at, while finding a partner who can step in and offer guidance where it's needed. And really, in many ways, this is also the goal of AARP, helping people have independence, choice, and control in ways that are beneficial to them and society as a whole. But the truth is, social determinants and disparities in aging can present challenges to accomplishing people's goals when those goals are being independent and having choices. So to address this issue, it's important to find integrated approaches that bring businesses and communities together to improve the lives of seniors. And that's what Ron Bridges, Paula Cunningham, and Beth Finkel are here to talk about. So please join me in welcoming them for this panel discussion.
Good afternoon, everyone. I'm pleased so many folks came out to our coming out party. AARP has been functioning in the state for the last 18 years with state office presence, but we have been here much longer. You think you know many of our past leaders, and I want to call your attention to my partner, state president, who's a volunteer, Charlotte Whitaker. Ms. Whitaker is from Ohio County. We could not do the work that we do at AARP without her devotion to the work that we do, our commitment that she has, and the energy that she represents and models for my team and for myself. I want to acknowledge CEO Bushman. I saw the chairman of the HEN board here, Mr. Headley, and of course, Kent Euler from the Greater Louisville, Inc. Watched all of those folks working together for a number of years and have seen the interest that they have in making this community better in a number of levels, a number of different areas, and in the area of health determinants. It was very important for us to plug in and be a part of that. When we saw that the subject matter was social determinants of health, it made proper sense for us to sign on as the theme sponsor of this event. We have 470,000 members across the state. Charlotte and I have responsibility for working with the members across Kentucky with a focus on Lexington, Bowling Green, and Louisville. Louisville is a community of presence, and I want to acknowledge some of our stalwart volunteers that are here from the Louisville community team. They are hardworking individuals, and they are plugged in very intimately with our partners on the age-friendly Louisville movement. Other leaders are here from that movement, Metro Government, the Traeger Institute, KIPTA, fine organizations that are helping us move this effort. And I heard great news last night. I probably am not privy to say it, but keep your ears peeled for what is going on with age-friendly in the state of Kentucky. AARP Kentucky has chosen Disrupting Disparities as a takeoff point across the country because we believe that what we do for all, what we do for one, we do for all. And disparities, equity, point out very clearly that we're not doing some things right to make sure it's an option for the lifestyle and the longevity of lives if there are folks falling by the wayside. It's very instrumental that we pull together groups that are already working on this stuff. AARP is not talking about reinventing any wheels. We're not talking about stepping on any toes. We're just talking about seeing some folks talk about the same thing in a few different languages. And an outside observer says, well, you're working on very much the same thing, but can we at least find a common way to talk about those things so that potential funders, potential members of the community that want to get involved are all acknowledging that we're working together. When AARP looks at the work on disparities, it emanates from a national movement that we have called Disrupt Aging. And the whole notion behind disrupting aging is to reinvent the way that folks view aging. As Nigel and our friends from the national office said, we're looking at folks living past 100. He said his daughter will be potentially 102. At least one of two folks could be living beyond what we can all imagine at this point in time. So there are things that we need to do to make that reality for everyone by making a lot more attention to how we can address the disparities, bring equitable care to all that are in this great city. And one final note is we look ourselves as the epicenter of healthcare in the aging space. And I would contend that what we want to also be is the epicenter for optimal health. Enterprises, consumer organizations, grassroots entities, all striving for that same thing so that we can not only represent businesses and entrepreneurs and innovators that are doing things in that space, but also point as we go around the nation bragging about those kinds of laudatory positioning, as our marketing to external entities that are looking at coming to Louisville. We want to also say you're coming to a community that's healthy. You're coming to a community that has a livable environment, that it's great for all ages. So with that, I want to introduce you all to my colleagues that are looking at disparities in their states, New York and in Michigan, in quite different ways, but it just lends an idea of AARP attempting to surprise not only its members or folks that aren't aware of what we do, but to surprise them about things that we're doing that's beyond selling insurance or it's beyond fighting on Capitol Hill. But we're trying to look ahead and look forward, see how we can connect dots to create some synergies around the problems that we're trying to address and we've identified. First up, and we also have the Honorable Senator Gerald Neal, who has, in my formulating some of the thinking around how AARP could leverage its interactions with the business community through GLI and the health networks around the Health Enterprise Network. It's been a counsel to me in terms of helping me understand the history and the long-term legacy of some of the disparities. And so he'll have an opportunity to share some of his insights, continue to promise to bring some solid guidance to the work that we're doing. And at the end of this, we want you to understand that Health Enterprise Network is agreed to take the disparities work that we finally determined is appropriate for Metro Louisville and take that into action as a part of their efforts around social determinants and the way to address those for far many of us that are being left behind. First up, I have Beth Finkel, who is the state director, my peer in the state of New York. Beth has done tremendous work around the areas of age-friendly New York. She led the enactment of the first statewide age-friendly law. So New York has placed money behind making its state a age-friendly community, age-friendly state. A number of cities there that are a part of that. So I'd like to have Beth talk about disparities and the approach that was taken there, and then we'll have safe questions for the end, but we'll talk further about how and where AARP can make its inroads here in Kentucky around this issue. Beth, please.
Well, let's see. I love the way you're looking at the intersection of age-friendly and disrupting disparities. You know, we in New York, you all know this, right? We in New York like to be number one. But here's our bad news about being number one. We are number one in the country when it comes to disparities in earnings. The top 1% in New York make more than the next 99% combined. In fact, they make 45 times more than the next 99%. I mean, it's just astounding when you think about that. And when we look at that, plus the confluence of the changing demographics, and I know talking to a number of you here in Louisville, you're seeing some of the things that we're seeing, and that is that our aging population is growing. It's the fastest demographic growing, not only in the city, but in the state. And our demographics of people of color are also rising at a much faster pace. In fact, the last 10 years that we looked at, it was a 16% increase in people 50 plus communities of color. At the same time, we're seeing a decrease in those that are 49 and younger. In New York State, it was 6% decrease in the number of people 49 and younger. So, you know, we're seeing this confluence of more older people. That's a good thing in some regard. You heard Nigel talk earlier about the longevity economy, right? So who's you know, taking all their money and spending it in the community, right? They're going to the local grocery stores. They're not hiding their money offshore, I assure you. They go to the local drugstore, et cetera. They're paying their taxes. So how do we keep people in their homes longer? They pay their property taxes, they support their local governments, they support their local businesses, because that's what we're talking about today, right? It's really the 50 plus. And matter of fact, in New York, 50 plus contribute, hold on to your chairs, $700 billion a year to the GDP of New York State, 700 billion with a B. So this is nothing to be looking the other way at. And you know our Governor Cuomo, he's pretty savvy, and he has seen that. And that's where the whole age-friendly piece came together. But before I go there, I just want to go back to the disrupt disparities, and if that's okay. So we looked at those numbers. We looked at the income disparities. We looked at the rising number of demographics. And then we looked at how that impacts people that are 50 plus, African American, Asian American, and Hispanic. And we didn't do this alone, just as Ron says, that's not how we operate. We brought together the NAACP, the Urban League, the Asian American Federation, and the Hispanic Federation. And we enlisted some academics to do some deep dives for us to understand exactly where those disparities were. And then how do we identify solutions to get us to changing the dynamics of what's been going on for a very, very long time? And we've had some immediate successes. In the back, I think there's this,
Yes.
and there's also a link, right?
Yes, copies of both the Michigan and New York report.
Sorry.
in the back.
So we've had some great successes. We've had successes in 3 different areas: economic security. New York State was one of the early adopters of what we call secure choice at AARP, which is a retirement savings fund that the state could provide, so that small businesses that didn't want to take on the fiduciary responsibility of providing a retirement savings plan for their employees, because it's both costly, but there's also a lot of paperwork and a lot of responsibility involved. By having the state take that on, it takes away the fiduciary responsibility for the company, and also the plan is no match. So companies do not have to put, they're not allowed to put a match in. So that's a major difference. And what we found was that 50% of people who work for private industry in New York do not have a way to save for their retirement. They don't have a pension, they don't have a 401k. And I think you all know the mission of AARP is to have people be able to age with dignity in their communities and age the way they want to age with their own choices. And we know, without money, it's darn hard to age the way you want to age. So so that was one of the early wins, because people of color actually were made up more than 50% of that population that is not able to save for retirement. In fact, it's up to 70 and 80% in some of those employee groups. So that was something we thought we could take direct action on. We also got more money that went into the State Office for the Aging. We had not seen an increase in the money to the State Office and the Aging, like $1 million here, $2 million there. It was like dribs and drabs, right? We got $15 million this year, which was a big increase for us. And that was, again, directly back to us putting pressure on government about this disrupt disparities data, because if you want people to live longer in their own homes and communities, you better support those systems that are going to help them be able to do that. And, you know, the data is all there. Everybody's talking about data today. The data is all there about keeping people off of Medicaid and keeping them in their homes longer. You know, there's just no question to that data. I could go on and on with wins that we've gotten. I just will say one more thing, where now our next goal, we're going to be launching our Disrupt Disparities 2.0. We're going to be looking at gentrification. We're going to be looking at the cost of RX drugs. All of this to people of communities of color, how they are impacted significantly more. The cost of utilities, I don't know down here, but in New York, boy, our utilities bills are skyrocketing. And if you don't have a lot of discretionary income, again, you are behind the 8 ball. So I'm going to give my colleagues here a chance to speak too. Thank you, Rob.
Let me probe one other question, because I was intrigued. Kentucky has an issue around the availability of broadband. Mm-hmm. And I understand that was one of the areas that you all looked at in terms of disparity.
Yes.
And
Because
folks don't think about
communities
that.
of color, even in inner cities, we're not getting the same access. And funny you say that. We submitted testimony yesterday because we now want to look at the rural disparity of lack of broadband and how that particularly affects our population. And I should have said that next part of Disrupt Disparities will be looking at disparities in rural communities. It's not just communities of color that feel this, but rural communities are really feeling the impact of a lot of disparities in our systems. So we're going to go there next.
Yeah, congratulations. One of the things that working with AARP is the beauty of having the autonomy in state offices to work on issues that resonate with the people and bubble up from the communities that we serve. there is obviously a framework and a strategic enterprise direction, but we're free to work on a number of issues and take things like disrupting disparities in a direction that is most suitable for your particular state. Another way that this has been undertaken is the way Paula has done in Michigan, and I'd love for you to hear about that.
Thank you, Ron, and I also want to thank you publicly and also thank those who are here. The cross-section of this audience is really inspiring because there are enough people here, even just in this room, who can make this happen. It takes a village, but it doesn't take the entire village. But the number of people who just showed up to be a part of this is very, very inspiring, and I also want to thank Ken for that. I've been at AARP 4 years, and when I started, I asked who is doing the most, who is doing one of the best jobs here at AARP, and Beth Finkel's name came up over and over again, so I spent some time with her when I first started AARP, and I've been trying to follow in her footsteps ever since then, so I just want to say that and say thank you for all that you've done to help me as well. But every state is different, and one of the things that I learned a long time ago, you have to know your audience, right? You have to know who you're talking to, you know what motivates them, know how you can impact change. I worked at Kellogg Foundation for a long time ago, a century ago, and one of the things they always said is that we already know so much more than that which we do. So we know a lot. We know there are disparities. We know that social determinants make a difference. We know that we are Michigan particularly is the fastest growing, I think one of the top 10 fastest growing states in the nation. We know that people are living 85 and older. That's the fastest growing segment of the population. We know a lot. We know that diabetes can be prevented with the right kind of diet and exercise, in many cases, not at all, but in many cases. What are we doing about it? And so in our state, because we could not approach our disruptive disparities the same way that New York did and get a win. We just couldn't, because our state's different, you know our audience. We'd had the Flint water crisis, we'd had the Detroit bankruptcy, and quite frankly, and this is gonna sound, sorry, Senator, but this is gonna sound a little crass, the legislature just don't wanna hear about another ethnic issue, racial and ethnic issue. They go, oh yeah, okay, you know, and it's a very conservative state. That's not a judgment, it's just what it is, know your audience. So we had to figure out how to approach this because we know so much, but we've got to do something. I'm so beyond just talking about things. I don't sit at tables anymore where you just talk. You got to show me what the end game is, how we're going to get there, and let's work on the game plan, and I'm all in. You know, as someone once said, the vision is free, but the struggle is real, okay? It's going to cost you. And so we were all about pulling people together because it's not just about what we know and what we can do, but there are other organizations, the Michigan Food Council, the AAAs, the Area Agency on Aging. There are a lot of other organizations who are doing the same thing. So it did not have to be AARP only at the table. So just to kind of short circuit some of this, we pulled together other organizations and said, what are your major priorities for your organization? And how can we work collectively? Because our voice with 34 agencies at the table will be a lot stronger, even though AARP in Michigan has 1.4 million members and you know our voice is heard. It'll be a lot stronger with 34 other agencies. So we identified a continuum of care. That's our caregiving, and not just caregiving, care, health care was a major issue that surfaced or bubbled out of all of this in terms of the disparities that exist in those areas. And we chose 3 areas. We chose or I should say the research and the disparities surfaced primarily in 3 areas. Chronic diseases, that's everything from heart disease to diabetes to mental health, chronic diseases. Then we chose, the other area that we chose was home and community-based services. You've heard over and over again today, people want to stay at home, we know that, except for the maybe 1 or 2% who don't want to be home with their children coming in, they'd rather go somewhere else. And then we heard, and then telehealth. You know, the technology that's out there today is just incredible. You heard about it earlier, you know, in terms of all the technology. But if you don't have broadband, you're going to be left behind. If you don't have access to the internet, you're going to be left behind. It's easy for me to go home and pull up on my little iPhone, you know, look at my healthcare charts or to contact CVS or to see a doctor in 30 minutes. But if I don't have access, or if I'm older and don't know how to use that, I'm going to be left even further behind. So those were the 3 areas that we looked at in terms of areas that we in Michigan wanted to focus on. It was disrupting disparities, a continuum of care, and we looked at just those 3 areas. And so then knowing our audience, what we learned was that what we already knew, knew this, but it was validated, is that there are disparities all over the state. not just in the urban areas, but in the rural areas as well, there are disparities. There are disparities for people in the Upper Peninsula in Michigan. They go to Wisconsin for some of their specialized care because there's no physician available. So therefore, we could then go to the legislature. We could go to any member of the legislature, regardless of what the partisan issue, because we are nonpartisan, and say, look, Mr. Legislature, if we can reduce diabetes by 1% in people who are 65 and older, we could save the state of Michigan $34 million. 1%, 65 and older. We want to work to do that. If we can keep people in their home versus sending them to a healthcare institution, which sometimes is necessary, but if we can keep them in the home as long as possible, for every dollar you spend to send someone, or subsidize to send someone to an institution, you can save $2 if you keep them in your home. Now that message resonated with our base. And it wasn't just AARP validating the numbers. We had a third-party validation of all the numbers, all the data, and it got us to the same place we wanted to get to. Look at the communities, look at the urban areas, look at the rural areas. It got us right where Beth is in terms of some of her issues and areas. It got us there, but it got us through a different door. And then we'll continue to work with universities and colleges, and we'll talk more about that later, but we had them at the table as well. They did tremendous research for us. So it wasn't just here's AARP advocating for those who are 50 and older again, although that's a really good thing. I don't make it sound like it's like, oh, it's wonderful. But it were 30 some other organizations also doing the same, having the same advocacy message that we had. And in terms of return on investment, the governor set aside $20 million. The brand new governor has $20 million in her budget for broadband in the rural areas. In terms of return on investment, we just launched in October of last year, less than a year. So in terms of an investment, we received a $500,000 grant from the Michigan Health Endowment Fund to also look at some of the determinants of social health. And also in terms of investment, we are doing community churches, fraternities, sororities, programming on diabetes and how to prevent diabetes. And then Wayne State University is also having their students are going to Health and Human Services, talking and meeting with real patients with diabetes in other areas so that they can collect that data for us so we can continue the journey. So I'm going to stop there and give everyone plenty of time, but Beth and I could talk about this for like 5 days and 1 hour nonstop, okay?
Very important comments, and I think many of you will see why I enjoy having two great big sisters that are helping me along the way in Kentucky, just emulating a lot of the work that they're doing. Senator Neal had sat down with me and we talked about this issue, and he gave me an education on the history of a lot of this work in the community, and we got to talking about Healthy People 2020, and it was, let's reduce disparities, next eliminating disparities, and then in 2030 the goal was to, equalize or equity across all delivery of health care. And I think that gets at the root of I think, his career as a public servant, seeing these kinds of issues and trying to pull together the right parties to make some advances and make some change. And Senator, I'd love to hear your thoughts on what you're hearing about our states to the north and northeast, your vision for health equity for your constituents, and any other things that you'd like to share in your most eloquent way that you are known for. Thank you.
He set me up really good, didn't he? First of all, this is a very interesting discussion. Ron, thank you for inviting me to say a word or two. I was listening intently at the initiatives in New York and Michigan, and it's very encouraging what I'm hearing here. And then I got a little side comment from my friend about legislators. And let me tell you, she hit it right on the head. And it struck me as she was saying that, where did my mindset come from right now? And why am I doing this, what I do in the state legislature? And it reminded me of when I was a young man and an older gentleman approached me. He was observing me doing all kinds of activist type of activity and demanding things right now and professing what needed to be right and should be done. And then he just quietly said to me, he said, son, you're gonna have to understand that nobody's gonna listen to you unless you can show them what they're gonna get out of it. That's a very fundamental statement. And I think that's what I just heard here. Because you can't just take a good idea that you believe in and you think someone's going to embrace that. They have to see how it connects with them. And that's the art of doing policy in the legislature, and that's what happens with legislators. It's ugly. It's difficult. It's designed to be difficult. But policy is critical, and I'm going to get to you. Policy is critical because policy drives everything. Or what you don't do in policy also affects your prospects. So paying attention, that's important. So how does that connect to the average person that's getting up every morning, trying to keep a roof over their head, trying to keep a job, trying to maintain dignity in a very challenged environment? Well, the fact of the matter is that they are preoccupied with what you might loosely call survival. We all on some level, but that's where the rubber meets the road. I think we all function in that way at some level or another. But the deal is, how do you create a framework where they understand what they need to do intentionally to add to the solutions? That's the way I look at it. So here's what, at least my little small take on it. We put together a group called the African American Initiative. In fact, it was called the African American Community Agenda Initiative, called the AAI for short. All about policy. We don't do program. There's a lot of folks out there struggling from day to day doing excellent work, and some not so excellent because they don't have enough sufficient information or resources. But the fact of the matter is we deal purely with policy. And what we do is we bring policy makers and implementers in the same room, same framework, with intentional people. We call them do-gooders. See, we're not really interested in do-gooders. We really don't want to see a do-gooder unless they're intentional and they bring with them some skills that we can utilize in a context where they are interfacing with policymakers. We want them to learn. There's a dynamic that takes place between these individuals. We create policy teams. These policy teams interface with policy implementers, and our whole thing is designed to engage that process, sort of a symbiotic relationship. So when we start talking about folks that live from day to day and they're separated from policy, in fact, most folks don't understand the policy that has driven them to the context that they're living in anyway and being affected by, or even the disparities that they're suffering or they're challenged by. They do not even understand the dynamics. In fact, I'm not sure I fully understand it unless I really drill down as an academician, so to speak. University of Michigan, by the way. So, sidebar, Michigan State, University of Michigan, we found it out. But here's the point. The point is, what we found was when we engage people at that level, that they become more proactive, more intentional, more educated, more focused. In fact, they came back for more. In fact, they began to challenge what I was doing. Wait a minute, you're moving too slow, Neil. And I said, wow, this is really good. So what we're trying to do is make sure that at the community level, that those people can drive, they're part of the dynamic that drives those of us that operate on a high policy level, i.e. the government in this instance, that they have a role in this particular piece because it directly affects them. Now, one of the things that's grown out of that, in fact, it's germane to this discussion, is the fact that now I'm developing a piece called, it deals with policy in terms of health disparities. So just think what a policymaker does. A policymaker has to have sufficient information, if he's doing the right job, right, to make a policy that's going to impact a lot of people, utilize and direct resources to a particular problem. But if you don't have sufficient information, if you haven't vetted the issue sufficiently, then what are you doing? So what we're putting together now is a piece that requires health disparity impact assessment. So now your health departments, if triggered by the bill, the policy piece we're putting together, triggers effectively, then what it will do is put into action the people who know or who can get that information to the policymakers before they make a policy decision. And that's the key, having sufficient information before. So that's what we are focused on. I hope that gets to the subject matter that you're speaking of.
Indeed it does, thank you. And we'll be engaging with that council coming weeks. I think we're talking about RX greed as a potential jumping off point. Beth, you've teased us a bit with 2.0. What are some of the topics there, and have you followed similar procedure or process engaging the same universities, or how have you come up with those topics? And then Paula, I'd like to hear more about your vision for what's next in Michigan.
So yes and yes. You know, very much like being here today, we went out and did a lot of listening across the state, especially in particular counties that were even more affected by disparities. And we also, you know, enlisted our partners. And so from that, we decided that, so the first set was livable communities, financial security, and livable communities, which is housing and transportation. And actually, I didn't go through all the wins that we had in each of those columns, but we had significant wins. Not everything, you never get everything, but we're going to go back to the well again. We don't give up. The next set, though, after gathering even more information, was RX affordability, because you know we know from all the data how terrible that issue is and how it's affecting people, especially in New York State. And I'm sure you all know this, but Americans in general pay 20 times what other people in other countries are paying, so there's something's got to get done here. Caregiving is an ongoing issue. The burden of caregiving falls on family members. Without the family members that are providing long-term care, our Medicaid system and all of our health care systems, honestly, would collapse under the weight of it. And so what can we do to help people help their family members? So we've got aligned a number of issues there. Part of that is getting more money into those community services that can help secure people in their home. Rent reform, New York State, New York City particularly, we're a city of renters. There's more than 1 million rent-stabilized apartments, 1 million apartments, not to mention how many people are living in them, that are constantly under assault of having their rents increased outrageously. All of you who told me your kids come to New York on a regular basis, you're driving up the costs of our rent. And so people are really struggling. You know, you retire on a fixed income, you've budgeted what you think you're going to pay for your home, and then what happens? You get displaced from your community. So we've gotten some great wins in that, but we're going to keep pushing the envelope. Also with foreclosure, we know that there were communities that were redlined for foreclosure, that there was deed theft and really terrible machinations. So we got actually $20 million in the budget for legal services to help those people before they lost their homes. But I can go through a whole list of this stuff. Utilities I mentioned before, because of the impact, you don't have a big discretionary income. You know, what are you going to do when those prices keep going up? And finally, gentrification, which last night at dinner, some of my dinner partners actually here in Louisville were talking to me about how that's becoming a greater issue. And so, you know, when I bring these up to our partners like NAACP and Asian American Federation, Hispanic Federation, I mean, they're just there. They wanted to work on these issues, but let's face it, they have big constituencies. They're very worried about children. They're very worried about immigrant communities. There's just so many areas. So they can't really take their resources, you know, and put it 100% behind this. So they are so glad that AARP has taken up these causes, that we're doing the research, back to what you were saying, both of you, about data. We're able to give them the data to prove the points of issues, policy issues that they're working on. And that's been really a great win-win all the way around. So that's the next stop along the way. We are going to have a
Exciting
website.
stuff. Yeah.
So I'm going to send it to you when we get it. Rockefeller Institute, you talked about academic partners.
Yes.
Rockefeller Institute, which is part of our New York State university system, but it's our public policy, and it's pretty well known nationally. They are creating, it's almost done, a Disrupt Disparities website, which is going to house all of our stuff. It's going to have all of Paula's stuff too. And if as soon as Kentucky wants to add your research to it, that'd be great. So people around the country can see that people are working on this and see great data, but also great ideas to move the policy needle.
Fantastic. Paula, please.
Oh, geez. I'll just try to make this as short as possible. But we engaged students earlier on. You heard me talk about the university students, graduate students. And so keeping them engaged is really important. Everyone has an aunt, an uncle, a grandmother, or someone who is suffering from one of the chronic diseases or who doesn't have access to some of the broadband. So that's why now, not only are we working with Western Michigan University, but we're also working with Wayne State University, and the students will be going out and doing research with the patients that they come in contact with. In addition to that, autonomous vehicles, we looked at why people aren't keeping their doctor's appointments, particularly older adults. Why do they not keep them? Transportation was a major issue. So we're looking at the city of Detroit in particular, looking at some work with AV. You heard autonomous vehicles, you heard a little bit about that today. I'm talking very fast, I know that. We heard a little bit about autonomous vehicles today, and there are prototypes for sending emergency vehicles to the homes of older adults. Well, we said they're not going to get in a car without a driver. They're not going to. We know that. We've already done the research on that. So we're looking at using some emergency medical service folks, so looking at retired police officers to have them accompany people to the doctor's office to keep those appointments. So a lot of what we're looking at is prevention in addition to policy. And I have with me the entire legislative agenda that we now have as a result of the Disrupt Disparities. So we are doing the advocating on the policy end, but at the same time, prevention, trying to make it better so that policy takes a while. It takes a while for the legislature to respond. AARP wants to drill down in communities, the rural communities, and talk about if you take cod liver oil every day as a child, you may not get diabetes. You know, just simple little things that can be done. In Denmark, the prevalence of diabetes is less than 1%, and they have in their hotel room coffee, tea, and cod liver oil. So children know that. I mean, little things that we can do. It doesn't cost an arm and a leg, so you got 1 minute and 25 according to the timer, so I'll stop.
I'll ask the distinguished senator to yield for a few questions from the audience. Senator, take back your time. Oh.
Senator, I'm kind of curious, with our colleagues here from Michigan and New York, are there some strategies or best practices perhaps that we could use that assist your client efforts in Frankfurt, try to get us to truly become a commonwealth that's friendly for the Asian community, Asian sector? Because you got to build that, as we know, with our legislation.
Yeah, well, you know, it's a difficult process. There's no question about that, and there are all kinds of competing challenges. And I think the comment is correct. Policy takes time. There's no question, but policy is necessary,
Absolutely.
regardless. So engaging that political process from everything that you hear from the bottom all the way up is important to do that and being active and attentive to that. But we also deal on a national level as well. For instance, I'm on the national board of a legislative organization, and we deal with this subject matter across the gambit. It includes Michigan, it includes New York and others that are dealing with these disparate impacts in terms of health outcomes. So this churning and this raising of awareness and being persistent and targeted and focused and engaging is necessary. I can't do what they do, and they can't do what I do, but what we're doing is interrelated, because this whole thing is dynamic, it's interdimensional, multidimensional, and it's also interrelated. So there's a lot to do, and we invite you into the fight, into this particular area, and we're gonna have some wins, and we're having some wins, even locally here in Louisville. Our health department deals with health equity initiatives on the ground in many kinds of ways. They're on the ground doing these things. And there are a lot of organizations that are tied into those initiatives locally, on the ground, doing things. Maybe small things to someone, but when you look at the whole totality of what's going on, they add to the better outcomes that we're all seeking.
I'd like to thank the panel. I'd like to ask you all to give a big Kentucky appreciation. That concludes our session. Thank you all.